to all the respected doctors present here. I, Dr. Snehal from the USV Medical Affairs team, welcome you all for yet another interesting session in the CME India series, where we will be speaking on a very interesting topic today, what physicians need to know about AI. So this particular program is in association with the Indian Diabetes and Cardiometabolic Diseases Association and the Diabetes Research and Welfare Association. Without much ado, I would now like to introduce to you our moderator for the evening. We have with us Dr. N.K Singh, sir. Sir is an MD, FICP, FACP, FRSSDI, and also from diabetes. He is the diabetologist physician, Dhanbad. He is the director for Diabetes and Heart Research Center, Dhanbad, chairman, RSSDI Jharkhand from 2019 to 2023, executive member for National RSSDI 2022 to 2025, ex-governing body member for the National API, ex-chairman API Jharkhand and CCDSI BJ, edited the Millennium Book of Medicine. He is the associate editor for the Postgraduate Medicine 2021 and has edited monograph on COVID by ICP API 2023. He has more than 40 national and international publications to his credit, and he's also the admin and founder for CME India. With this, dear sir, we welcome you and I hand over to you to introduce our panelists for the evening. Welcoming Dr. N.K Singh, sir.
Thanks, Dr. Snehal. So it's a great pleasure again in the next series of the CME India webinar, but this time this is in association with the IDCM, as you told, and Diabetic Research Welfare Association. I also welcome Dr. Akash Singh, who is chief of this IDCM, and Dr. Vijay Patni. I don't know he has joined or not, but he will be joining maybe. So Dr. Akash Singh is also here, so he will also moderate. He will be a co-moderator for Dr. Akash Singh. I will introduce Dr. J Lakhani, and you will introduce Dr. Alok Modi. So I think a great pleasure today that Dr. J Lakhani, I think he's making new waves in India and internationally also, in doing lots of research and lots of writings and for teachings for the CMH. So he's the current designation is consultant endocrinologist at the Zydus Hospital, Ahmedabad. He also founder of the Mellitus Healthcare and LLP and Algomed. And as you see here, 26 publications, 15 book chapters, many awards and achievements. And as I told you that he's developer of several apps in the endocrinology and noted many. I think I told you that really whenever you go on the websites and you search anything, I think you will get a name from something from Dr. J Lakhani. So welcome you. And Dr. Akash Singh, please introduce Dr. Alok Modi. Next slide. Yeah. Dr. Akash.
It is my pleasure to introduce Dr. Alok Modi, who is basically, we meet quite often, and he is a brilliant orator, especially in the field of artificial intelligence in medicine. His current designation is he's a physician and diabetologist, Jupiter Hospital, Kevalya Hospital, and Dr. Modi's Diabetic Center. He basically has worked as a faculty in Shivaji Hospital and Rajiv Gandhi Medical College, and he's a faculty member in RSSG. He is basically a faculty member in all the national diabetes and many endocrinology conferences in India and abroad. He has publications in precision diabetes medicine, publications in JAPI, co-editor and one of the authors in the book Digital Technology in Medicine, Clinical Medicine, contributed chapter to book Diabetes to 360 Management in 2023. And he has a lot of awards and achievements by RSSDI as one of the top 10 reviewers for reviewing it in International Journal of Diabetes and in developing countries. He's been awarded top 10 Diabetologist of Mumbai in May 2019 by Indian Academy of Diabetologists and awarded the Best Scientist of the Year award by the Indian Society of Cardiology in October 2023. He is a regular faculty in the artificial intelligence in medicine. And he has recently been elevated to a key member post in American College of Physicians India chapter also. So with this, I welcome Dr. Alok to present in this webinar. Thank you very much.
So I think now I invite Dr. J Lakhani to formally invite Dr. S.B. Kulkarni and then start the proceedings. Dr. Om Lakhani.
Okay, sir. Yeah, thank you so much, sir. Thank you for the honor. It's my great pleasure to introduce Dr. S.V. Kulkarni, sir. He's MD in medicine. I met sir, quite a few times earlier, and what he comes out as a very, innovative, progressive clinician. I think there are people who actually make big differences to our field, and I know Dr. Kulkarni is one of those. He's a consulting primary care physician since 1983. I was born in 1984, so he's been practicing longer than that. He was the organizing secretary for APICon 2007 in Goa. He's also a faculty member of Indian College of Physicians. He's a faculty at MGM University. I had a pleasure of meeting some of his residents also in one of the conferences. He has hosted the API technology workshop since 2010. Also, chaired the workshop at RSSDI in Mumbai recently, and he has done 2 grand rounds in the US at Yale and Middlesex Hospital and Hershey Penn State Hospital, based on technology. He has keen interest in technology, specifically in artificial intelligence, big data, cloud computing, data mining, and digital twinning, and other futuristic medicine and clinical and telemedicine options. So, sir, warm welcome to you, and please start your session.
Thank you. I'm just starting sharing my slides. Actually, this is our AI family. Yeah. Dr. Alok and Dr. Om, they are all part of so many of our presentations. So friends, right in the beginning, I appreciate the vision and foresight of the organizers who have taken a topic which is really the time of, it is absolute needed for everybody. What physicians need to know about AI. And I have got 2 very able friends, generations apart a bit, Dr. Alok Modi and Dr. Om Lakhani, who are going to be sort of a supplemental for all my presentations. This is me what Om told, and this was a very odd effort which has started from 2008 in API, which has given a fruits as in today. I don't have any conflicts of interest, no disclosures. I have not taken money from any of the software organizers or the equipment manufacturers to talk about them. I have purchased them on my own. I have evaluated, used, critiqued, and many of them I have thrown them also. Big question. Is AI that much unexpected? Is it like a tsunami? Yes or no? It is no. AI is as old as me. 1956. One, Dr. John McCarthy, he used the term artificial intelligence in a AI and United Nations conference. So what it is? It uses computers and machine process to simulate human intelligence, but it performs complex automated tasks. It seeks to reflect the abilities of the human mind. AI-enabled machines are also capable of exceeding it in a number of ways, especially the speed, by sifting through a large volume of big data. That data also done efficiently in order to identify patterns, anomalies, and trends. Best example, COVID epidemic. I will not call this as artificial intelligence. I have got many other names for that. It is augmented, assistive, affirmative, add-on, or accelerated intelligence, which we all physicians have. This made news 1997. A 2-time world champion. Can he be defeated by a chip? By Deep Blue? It happened. And it took us to the journey. So in this journey, I'm going to tell you only around 7 points. I told you about introduction, evolution, and history. Let us talk about what is AI, what are the principles used, what are the components, what are the types. Most important, what is the concerns, and what is the way ahead, what is the future, how to learn about it. In the types, I'm going to explain you 2 or 3 types of examples, but I think Om and Alok are the best people who will talk about it. What are the advantages of digital technology? A for accuracy, B for big volume, C for consistency, saving time, money, efforts, most important, trouble and torture of travel. Telemedicine has proved that waiting time can be as less as 2 seconds between the doctor and you. But friends, please remember, it increases your serum levels of confidence, concentration, competence, enthusiasm, and makes you acceptable, adaptable. All the physicians who are listening to this presentation, if you are in between the age of 40 to 60, try adopting technology from tomorrow morning. Like Dr. Singh and me, who are working for almost 30, 40 years, there are 3 questions. What are we, what we have done, and what you need to do. What we have achieved? We have conquered some diseases, we have discovered new diseases, prolonged life expectancy, reduce suffering, increase well-being, sense of well-being. My patient is interested only in 2 things: quality of life and sense of well-being. They are not bothered whether using your natural intelligence or artificial intelligence or whatever type of drug. Are we looking forward for a ray of hope, a beacon, a magic wand of hope, but not a panacea? Yes, then AI is the answer. How AI helps us? It tells you about the challenges and how to handle it. What is the biggest challenge? Explosion of healthcare data. There is a concept called as a medical literature doubling time. Previously, it was to 79 days or less. Now it is going down and down. It's a process which is dynamic, rapid, continuous. Updates are impossible. Nobody can match with this. And what it gives us? It gives us burnout, increased cost. And what is happens on the healthcare side? There is a prolonged drug, vaccine discovery, drug trials are prolonged. So these are the things which can be aided with the help of artificial intelligence, which is all around you right now. The mobile you are carrying, the smartwatch we are wearing, the predictive typing, what you are doing, it is all taken up by AI. It is ubiquitous, universal. It's a true milestone. Many of us, we have used abacus. Then we have gone to calculator. Then we have gone to desktop Dabba computers. Lot of connected instruments. But with a very strong, with a very good mobile, everything has come into your pocket. And the latest is ChatGPT, generative AI with unimaginable outcomes and potentials, which are going to be discussed by my other 2 colleagues. You might have gone through this editorial, which I combined. That is the digital technology in clinical medicine, from calculators to ChatGPT. It is available on the AFIH website. Friends, whenever there is any new technology comes, there are 2 things which happen. With the time, there are certain changes which happen, and with the visibility of the technology, you go through the 4 phases. Number 1 is technology trigger, peak of inflated expectations, trough of disillusionment, slope of enlightenment, and plateau of productivity. Remember what happened with pagers. Pagers came and pagers gone. There is something called as a Gartner's curve. In Gartner curve, if you see, this computer vision and AI is the only thing which is not at a plateau, but it is also increasing up and up. And there is a proof for that. There is an increasing focus of research on technology, artificial intelligence, machine learning, and you can see the healthcare market forecasted 45.3% increase in CAGR. Tell me any investment which gives you so much. And is it affecting India? Yes. This is by Dr. Sharma. The Indian healthcare industry is worth around so much amount. Sir, you have to give me 1 minute. There is it seems to be some problem. Alok, can you take over for a minute? Alok? Alok? Alok or Om, can you take over for a minute?
Sure, sir.
For a minute. I have got something, it is absolutely unavoidable. I will be back within 2 to 3 minutes.
Sure, sir.
Please.
Hello, am I audible?
Yeah,
Hello?
you are audible.
Yes, sir.
So I think.
Okay. So, right. So I have
So
to.
let us discuss. Let us discuss up to
Yes,
this
sir.
stage how you can see all these scenario as Dr. Kulkarni narrated.
Yeah. So I think, he's very right in one very important thing that he discussed, that we need to adopt technology very fast. I think, as doctors, we often are very slow in adopting change. I think that is one of the major drawbacks we have as clinicians. The reason is that we, often are very busy in our own lives. We are busy with, our patients, in the remaining time that we have. We are busy with family and a lot of academic activities and so on. I think at the same time, if you see any industry, if that industry does not adapt to the suitable change, adapt to the suitable technology, then unfortunately the entire industry goes for a complete change. For example, you would have seen, in the field of the medicine itself, you saw that there was a time when a lot of patients used to undergo CABG. Right now, then came the era of angioplasties, right? So that thing changed. Now you're looking at an era where you have a lot of medications which literally melt away the plaques. So you are looking at an adaptive change in the medical field itself, right? And again, as clinicians, if you don't see that winds of change, you are likely to falter back. Again, if you're thinking about diabetes, earlier you used to just measure the blood, urine glucose levels, and then you used to measure the blood glucose levels, and then you used to measure the capillary blood glucose levels. And then came, HbA1cs frequently being used. Now we use a lot of, CGM. So what I'm trying to say is that, adaptability is very, very important. And it's not very difficult. The point is that just keep your eyes and ears open, and try dabbling a bit into the technology, try understanding how some of these things work, be curious. And if you're curious, you will pick up a lot of these nuances which are there. And then you can use it very effectively in practice. Gone are the days when patients, it's very fast changing. Patients are not going to ask Google questions. They're going to ask, Chat GPT questions about their health, and Chat GPT is going to give very precise and good answers, right? So we need to be prepared for a sea of patients who are actually well educated themselves and well aware about the world. And I think it's very important that we cater to those public as well.
Thank you. Thank you, Om, for tiding over the things. Now, is my slides is seen?
Yeah, it is. Yeah.
Yes, sir, we can see that.
So
yes, sir, we
you can imagine the amount of money which is being involved in this subject, and this has been done the survey has been done in Indian market also, and we are going to have a very big surge of this technology. So what is it? Rapid transformation. Artificial intelligence in healthcare is going to be a promising future with a lot of challenges. Whenever you talk of intelligence, there are 5 steps. That is called as a DQ. Data, which is raw, consolidated into health information, that is translated into knowledge, that translated into insight, and finally you compare wisdom. So this is the huge analytical challenge. But even by January 23, there were 520 algorithms were approved by US FDA. So AI is acceptable, adoptable, but it is exponentially increasing. Mostly it is in visuals, video analysis, medical image diagnosis. It has got a huge impact on and exponential effect on the publications. Now let us quickly go through some of the jargon terms. Why physician must know about it? There are 4 organizations. Global AI market, 54% increase. Statista, Gartner, and Survey on Global Health Solution. It tells you that 95% of the customer interaction in any field will be powered by AI. These terminologies, we not go into the details. What is an algorithm? What is machine learning? What is a neural network? What is data mining? What is cloud technology? Let us try to understand only the 5 things. So what are the 5 points under which AI as an umbrella, which covers distinct but interrelated process? First is called as a machine learning, pattern recognition, computer vision. Deep learning, it is like a neural network. Then natural language processing. The fourth one is called as a large language processing, LLP. Don't go into the details of this. Try to understand the examples. And there is something called as a robotic process automation, or RPA. So you have got certain types of AI, which is called the narrow, general, generative, and super AI. So this is the weak AI, non-sentient machine intelligence. Perfect example of Deep Blue. Strong AI and super intelligence is one which we are a bit afraid about. So stage one is machine learning, then there is a machine intelligence, and then is machine consciousness. Let's take example of Siri, Alexa. What it's helping? Google Assistant. It is going to help you in Google Map also. It uses all the preformed images. What are the clinical stages in it is useful? Descriptive, summary, creation of analysis of historical data, writing a case summary, diagnostic, predictive by algorithms, prescriptive, it will give a form prescription, and cognitive, it will be used in a semi-autonomous monitor for decision making of any complex process. What are the positive benefits of AI on health? Number one, efficiency. Data analysis insights modified. 24/7/12 available. Accurate at the best. Personalized. It enables personalized experiences and recommendations. And safety and risk reduction whenever you are using your system also. So let us go through very few practical examples. I have got a chat bot. The patient is calling saying that I have got a chest pain. The chatbot has asked 5 questions. What is the type of the pain? Whether it is going to the right arm? Are you having sweating? Are you feeling restless? And are you having palpitations? What it has done in this? It has recognized the speech with the NLP, natural language processing. Then there is a neural network. It has associated across the symptoms. And with natural language generation, it has given you a advice that you don't require an attention of a specialist in primary care. Doctor is the best option for you right now. That means you are not suffering from cardiac pain. Second example, in the same screen, out of 10 cats, how I can identify one tiger? It's difficult for us, but easy for computer. Practical example, doctor's violence is a big issue. So there are now face filters to detect and identify the emotions. What are the emotions? Emotions can be happy to negative, anxious, not satisfied, argumentative, abusive, violent. Even it can identify odd belongings of the patient. Pushpak AI is the name of the organization which has got a CCTV modified with this. This has been proved scientifically that anger, disgust, fear, sadness, happiness, surprise can be detected by this kind of multimedia tool. And it is not a single process. You have to have analysis of so many things. You have to have animal models to do this, and then only you come with this. Third example, we are going to be surrounded by sensor and watched by a connected patient, which is a big data generator. All these parameters, right from your snoring of obstructive sleep apnea to ECG, is going to be monitored. And what they use? They use all kinds of sensors. Glucose sensor was the first sensor, 1973. It started in 1962, but it came into the practice in 1973. At the end of the year, you may come out with a patch like this. It is a sweat microfluidic biosensor. It will detect your hyponatremia, it will detect your hypoglycemia, it will detect even your serum insulin level. So this is a cricket team of different kinds of whatever the parameters which we take, they can be modified. There will be some central console, and then you can change the thing. There are a lot many computers for this type of machines. This is my radiology department. This is the machine, not bulky. This is the bulky film, and this is the where I can detect a small nodule in my chest. Before that, if I'll ask you, can you suspect diabetes from a chest X-ray? Yes. It is opportunistic detection of type 2 diabetes using deep learning from frontal chest radiographs, but the sample size was 1,32,000. Suppose if I got a nodule like this is not visible here, but with AI and color coding, you can magnify it. It will help you. And the first one what we showed is a malignant one. This one what you are seeing is a hematoma, which is a benign one. More can be things done on AI and chest diseases apart from the different components of your chest X-ray. This is the process by which the things go, and it has been concluded that by AI using 383 sets of CXR obtained in the past years prior to lung cancer diagnosis, AI detected diagnosis definitely help. Come down to a case of COPD, how it can be managed. You have got a spirometer which is connected to a phone. That phone is connected to the physician, and it tells you about early warning systems or predicts exacerbation. And this is the AI-powered inhaler which will be tracking the things. Not only that, it tracks the delivery technique as well as the compliance of the patient. From chest, come down to the eyes. Eyes are supposed to be the entry to the body. So don't forget a word called as oculomics. And this is a very good article, Diagnosing Systemic Disorders with AI Algorithm based on ocular images. Please go through this. This will be definitely a wonderful way of learning clinical medicine. What you can see, it can check glucose smoking status, CVS risk prediction, 70% accuracy as compared to the score method, CHF prediction. It is not very high tech. Smartphone camera, non-dilated pupil, you will do wonders in your clinic. And you have got a formula also by which it will tell you how the retinal imaging is remodeled and translated into cardiovascular risk. From the whole thing, let us go to something which is very exciting, digital medicine, personalized twin, Ohm's fourth disease, and he can talk about metabolic diseases there. Everybody likes gaming. So it's a mad world of medical gaming. See the names: Project Hospital, Fix My Hand, Nanoorganism, Surgeon 2. These are good training tools if they are used in a very proper way. And this is not latest. I have got a reference of 1967. Medical training game used in a computer for the teaching programs. So AI gaming in healthcare, it has a diverse application. And ultimately, game and clinical medicine is the same. There is a reward or game, or there are bricks or bouquets. So it unveils the dynamic frontiers by allowing AI's impact on gaming and healthcare innovation. And what it eliminates, one of the biggest problem, this is called as a non-player character behavior. There is no bias. That is really something which is going to be a big point of discussion and debate as the AI evolves. Let us come to the last point of discussion, generative AI. The potentials are massive. Om told about ChatGPT. But it has got huge number of potentials. Medical chatbots, personalized treatment plans, and simulations like sepsis, stroke, AMI, status osteomatics, epilepsy. It will teach the student different kind of things, hypoglycemia. But there are few ethical issues that we can see later. MedPalm 2, it is an expert level medical large language model, and this is the thing which cracked the US MLE examination. And even on the CC, the NEGM clinico-pathological conference. Suppose if I'll ask you a question that you combine all the images into one video within few seconds, not possible. But now this is the latest gift from Google, G Poet. At the end of every presentation, people are tired. So I just ask her one question, that put an yawning Mona Lisa near the real one, and he has put and given me a real picture. So Video Poet is a modeling method. It is a high quality video generator, very good for patient education. It generates video from the text and audio output. So much of your work is reduced. I can argue anything like Albert Einstein playing chess with Narendra Modi on Great Wall of China in New Jersey, or with our Sushil Kumar Shinde in the background of Paris. It will give me the picture of it. So my last 2 points, the concerns. What are the obstacles and who creates the obstacles? We create the time frame, attention, learning, distraction. Please let us use as a companion, not as a competition. It is not an ornament or a decoration piece on your table. Your 2 lakh rupees mobile or a latest iPad which is you are using. So you have to change your mindset, those people who are not using it. People consider disadvantages of AI. But please remember, when the computers came into banks, the bank employees were on strike. Job displacement, ethical concerns, lack of creativity and empathy, cost and complexity, reliability and trust, dependency on technology, but it should not create intellectually dependent dumps. So potential misuse of AI technology, like from Avengers to Revengers, that is a real point of concern. The disappointment starts from the expectations. So don't expect too much, too fast and too easy. The greatest danger of AI is that people conclude too early that they have understood it. So there are diverse opinions on extremes of people who want future of self-driving mass transit vehicle on the routes designed by the algorithm. You want a driverless car, but you don't want to adopt the health checkup which your doctor is asking for. As AI's companion, competitor, or comprehender, catalyst, you have to decide. But according to me, it is friendly, fluid, functional, facilitator. AI is adaptable, but still not very adept on truly understanding. For example, clinically, I get a patient with CT or with acute abdomen, CT abdomen showing gas around kidney. Acute emphysematous pyelonephritis is a serious disease, but the AI cannot convince, counsel, and comfort the relatives for a speedy intervention at earliest. This is the limitation. So this question asked by everybody, is it going to be a threat? 100% no. AI is about machines making people more effective, but please remember, technology will not pose an existential threat to the humanity. It will replace the physicians who are not going to use technology and AI. So this is more important. We must use this as our slave and don't allow AI to sit on our head. Last few points, from where to learn. So many sources are available. These are the further reading, journals, sites, blogs, and links. And of course, Dr. Om and Dr. Alok are one of the biggest source of all the information. This journal, can you imagine, artificial journal, intelligence journal in medicine? It is from 2007, the time when I had a first technology workshop in India, API in Kolkata. But there is a new kid in the block in medicine, that is NEJM AI. It is a very good journal. Second issue is out. Please follow it on Twitter. You will get some articles, but become a member. What is our aim? What is the aim of Dr. Singh also? Our aim should increase the H index matrix. It measures a country's scientific productivity and impact produced. India is 19. We should be in first 5 because we have got huge amount of data. But the research and the utility has been low. The onus lies on clinicians, institutions, policymakers, and we all. We cannot point a finger at somebody when 4 fingers are pointing at us. So please support and encourage the use of large language models in the research submissions. This is one very good article. What it tells you, it helps maximally enable the scientific workforce to produce robust novel scientific findings and disseminate them rapidly, broadly, and universally. This was an attempt which we had done last year. Dr. Alok Modi also has been one of the editor about this. So before we close the chapters, friends, as a clinician, we should thank our teachers and mentors. My sir, Dr. S.V. Sotur used to always tell that opportunities are endless towards the next generation. It is up to us how to use and take it. Do not get lost in the maze of apps or trapped in the web. Dr. R.D. Lele, he had written 2 books on computers when we were not even born. Don't forget these 3 friends of ours. First mobile phone by Martin Cooper, first touchscreen by Samuel Hirsch, and AI by John McCarthy. Friends, AI focuses shift from I, me, my, myself to we and all. There may be an idea which can be interdependent, involve people, inculcate culture of giving, sharing, teaching, learning. adopting innovation, inception, incubation, and implementation. All these words look similar, but they are totally different. Involvement of the target users. I will be very happy if somebody comes out with this and has got an intellectual property act and a patent on it. These are the things for which you have to have only two things. One is ask a question, or second is raise a hypothesis. In that, you will be really successful. It all depends upon how you look at it with a convex lens or a peephole, whatever is going to look. For all the younger generation, top 10 healthcare trends and innovations. Number 1 is AI. Actually, everything is number 1, but he is the captain. So I'm really happy to finish my presentation at this particular spot. I will invite questions, comments, interactions, debates, but I will definitely ask my panelists, Dr. Alok Modi and Dr. Om Lakhani, to have their comment and a fruitful discussion. Thank you very much.
Great lecture, Dr. Kulkarni. So I think you have given a new insight to the whole chapter and whole subject. So Dr. Om Lakhani, what's your comment first? Then I will invite Dr. Alok Modi, Dr. Bijay Patni, and Dr. N.K Singh. If you are there, please have your video on.
Sure.
Dr. Lakhani.
Yeah, I'm audible.
Yeah, fine.
So first of all, Dr. Kulkarni sir, thank you so much. It was a wonderful presentation. I think what sir did was encompass the entire spectrum of technology, not just AI, and showed us some practical uses of artificial intelligence which you can expect in day-to-day future. So I think it was a wonderful talk, and thank you, sir, so for that wonderful words.
Yeah, Dr. Alok Modi, can your comment?
Yes, sir. Good evening, sir. First of all, many thanks and a lot of thanks for this warm introduction. And Dr. Kulkarni, sir, doesn't need any thanks or appreciation. He's a buck of AI and medicine, and we stay like 1 hour apart from each other geographically, and we keep interacting very often. And his passion is something that one should inculcate, the kind of development he's done for himself, the kind of knowledge that he's imparted himself itself is a big enthusiasm itself is a big thing for others to follow. And I keep hearing this from many doctors in the conference कि हमारे बच्चों को ज़्यादा आता है. Children are more tech savvy. We need their help to even tell us how to use the mobile. I think we, except for Dr. Lakhani, I think, and with due respect to other panelists, I think we are all Buddhas enough, and I think we have come so far ahead. So first thing I would like to tell all the doctors, stop thinking like that. When we got into MBBS, we were the cream of society intellectually, and we are today also. It's a big pond. I mean, it's a big ocean. You just have to put your foot into it and feel the temperature of the water. Yeah, it's like that. Start putting your foot, start paddling, start swimming. Believe me, it's a very rewarding experience. I have just created 2 chat GPT builder, in which one I have created where you can find out the interactions in a prescription. It took me 15 minutes to create it. Second thing, very practically useful for me, and I would be happy if others can contribute. We get people with CGM, and we have a Tayar database, where we can see the glycemic variability, time in range, and so many things in the CGM software. But in a glucometer, we can't find out. So this will tell you the entire thing. A patient writes it on a piece of paper, all his sugar values for the last 20 days. You take a snapshot, you get the entire CGM data output from a glucometer. So ChatGPT is playing a wonderful role. AI is playing a wonderful role. One or two things I like to share. They've done some phenomenal studies in hypertension, and I presented this in the last BPCon. They are now reached a level where one AI can pick up hypertension, which is a cuffless pickup, which is phenomenal. Second thing, it can predict a person having a heart attack, a stroke or a bleed 4 weeks from now. Phenomenal. This is like Minority Report, Tom Cruise's movie, where they could predict the murder which was supposed to happen based on the mentality, and they could prevent the murder from happening. This AI can prevent a stroke from happening. And Dr. Bansi Sabu's talk, if you were to attend, the current insulin pumps can actually predict in type 1 when this patient will develop a hypoglycemic attack 4 days from now. I'm sure Dr. Lakhani will be happy to contribute over there. And the AI algorithms can prevent and adjust the basal bolus dosages in such a way that the hypoglycemia is prevented. There are tremendous physical applications. I'm not the speaker here. give you so many examples which are actually licensed by USFDM. They are working in real life, and we are picking up cancers. We are picking up 1 millimeter lesions in mammograms, in chest radiograms, which a clinician cannot pick up. We're decreasing the radiation exposure to a clinician. We're using AI in our own real lives. Our
Yeah,
patients are using
Dr.
so
Modi,
many.
I think, so many applications you narrated. So before I proceed to some questions, Dr. Vijay Patni, uh, Dr. Kulkarni told that those physicians who are not using AI, but it will replace physicians who are not using technology and AI. So this is a great comment. So do you think that at present, are you using it? And Dr. K Singh, you also told in the real life scenario, are you using it or just we are discussing for the future? Dr. Patni.
Thank you. Thank you, Dr. N.K Singh, and thank you, Dr. Kulkarni, Dr. Lakhani, and Dr. Modi for giving insight into this particular topic. I think Dr. Kulkarni has read the future, I would say. But yeah, I am using AI, maybe to not that extent as what Dr. Kulkarni and Dr. Modi or Dr. Lakhani is doing. Not that we have grown old, Dr. Modi, but just because probably we have not been able to cultivate into that culture yet. So we'll go slow, definitely, as per Dr. Kulkarni's advice. And definitely we will try to pick up more into this particular branch and use that modality in clinical practice. So I think what Dr. Kulkarni did was actually introduce the subject to almost all the physicians, and the applicability part is definitely, he has given all the applicability part and how it can be used. And presently using this technology in almost all the spheres will be a difficult option for all the physicians, but slowly introducing that into their daily routine or daily clinical practice will help them to slowly help them to slowly interest in the science, I think so. So that's
exactly. So yeah. So
my
Dr.
comment.
Akash,
And
Dr. Akash, also you tell in your clinic what you are doing for this.
My take on it is like this, that our branch is a clinical branch, and it takes a lot of time to actually talk to the patients, to listen to their complaints, and to record all their data. And apart from that, our focus is mainly on research publications. So basically, we realize the importance of AI definitely, but it has to be incorporated slowly for lack of time on our part. And having heard all the say speakers, Dr. Kulkarni, I've heard several times. Whom I always see his videos on the YouTube. His algorithms and all are quite informative. And Alok is also now coming up in a big way in AI. So we'll be taking cue from them, and we'll be definitely trying to venture more and more into AI in the limited time available, because everyone has a preference and everyone cannot master everything. So what we are into core research and core publications and all, which is our fort. So we'll stick to our fort and try to venture whatever way we would get time into AI. And our initiative would be AI in writing, AI in medical writing, AI in medical research. That will be the point where we basically we have started. We'll be gradually coming up with.
Yeah, I think Dr. Lakhani, there are 3 questions. You
Yes,
can
sir.
see in the chat box how is AI being used in diagnosis or treatment,
Okay.
and
So
how does AI complement the care provided by human healthcare professionals? This is very, very important point. And will AI
Yes, sir.
replace human healthcare providers? So before you comment, Dr. Kulkarni, please answer this dilemmas.
Okay. Om first.
Okay, okay, no issue.
Yeah, Om and Alok, I call them my academic hair apprentices.
Right, sir.
They are
Thank
my
you.
academic hairs.
So let me first focus on the diagnosis part, and I'll leave the treatment to Dr. Alok Modi. So if you talk about AI being used in diagnostics, and Dr. Kulkarni showed a very some beautiful examples. Let me first introduce the concept that what we need to understand is that there are certain human connections, there are certain clinical connections which we often miss in clinical practice, which big data can actually pick up, right? So there are certain correlations, there are connections. This is when you are using research constantly, there are things which a human eye can see, there are things which a human ear can hear, and there are things which we can analyze and consider, right? But at the same time, there are things that we often miss out. Now, my father is a physician. He once told me, and this is way back when I was just an intern. He said that I have noticed that those patients with hemiplegia and those patients with stroke, on the side where they have the lesion, they tend to have something called a toe up, right? So the toe is a slightly dorsiflex compared to the other side, right? Now this is a clinical sign, right? This is something we picked up in clinical practice when he kept seeing patients with stroke. But AI is like that master clinician, which often the things which a normal physician or normal a clinician would miss, they often pick up things. For example, you saw Dr. Kulkarni show X-rays where they were able to pick up a diagnosis of diabetes based on chest X-rays, or they were able to pick up small lesions which were often missed by the naked eye, right? So same, I think there is very interesting paper where they looked at voice as a biomarker, right? So depending on how I speak and depending on the intonations, depending on certain characteristics of the voice, based on the analysis, you can actually predict whether the patient has an endocrine disorder. For example, whether the patient has hypothyroidism, whether the patient has a diabetes, whether the patient has acromegaly, right? So there are certain things which a naked eye cannot see, which a AI can actually pick up. So I think AI is going to be indispensable in diagnostic categories, right? It is going to make diagnosis which we never thought existed. And the best part is that it is actually going to make this diagnosis much earlier than you used to do it in a previous time. I think that is the fundamental part. You'll get a big lead time. For example, with the use of better radiological technologies, better CT scan, HRCTs, mammographies, you are able to pick up breast lesions earlier. You're able to pick up lung lesions earlier, right? So AI will make it even faster. And to all the skeptics who think that AI is going to replace the job of a doctor, actually, let me tell you, in the next coming decade or two, it is actually going to increase the job of a doctor tremendously, because once you start having these, AI lesions, which are going to pick up small lesions on X-rays, or which are going to make diagnosis of diabetes based on a voice biomarker, where are these patients going to go? They are not going to go to an AI doctor. They're going to come to you, right? So it is going to open a floodgate of clinical diagnosis, and all of them at early stage where you actually can make the difference to the patient's life. Right, so it is going to make a tremendous impact to your practice in the next coming decade or so. Trust me, we used to all say that all this lab investigations done whole body parameters and kind of thing. We used to have a distaste for that. But if I see my own practice, every day I get at least 10 to 20% of my patients come from these routine tests which are done by people, and somebody has a slightly elevated TSH or somebody has an HbA1c of 7.1, right? You keep getting these patients, right? Where are these patients coming from? They would have been diagnosed much later when their HbA1c was 10 or when the TSH was 35, right? So you get this diagnosis earlier. So as doctors, as physicians, you are going to get a lot of these patients at early stages, and AI is completely indispensable in diagnosis. I think it's going to be very useful in diagnostic part. And I'll leave the therapeutic part to Dr. Alok Modi. Yes, sir.
Is it going to raise a lot of false alarms?
Which is interesting, sir. That's why we need the human there. We need Dr. N.K Singh to tell us whether what AI is detected, whether is it true or whether it is false, or whether it is a false alarm, whether it's a false positive, or whether it's something which is not. And that's why I think that's where our job really comes, and that's why we need to, as Dr. Kulkarni said, we need to understand at least a little bit about how these models work, how these correlations work, right? So if you are able to understand that, just like, for example, when we see a lab report, sometimes there are erroneous reports, sometimes there are lab errors, right? For example, biotin, a lot of people take a lot of high dose of biotin. There tends to be certain assays on thyroid function, you will have an abnormal thyroid function. Now that if you know that how things work, you know that probably this interaction is because of the biotin. So you ask the patient to stop the biotin and repeat the thyroid function after a few weeks. Same way, if you're a clinician who understands how AI is working in terms of picking up the diagnosis, then you will be able to say that perhaps, boss, this is a false diagnosis, this is a false positive. Let us confirm it with a second investigation, or let us confirm it with a second test, right? So that is where our job becomes very critical, that as clinicians, we not only understand the diagnosis, but we also understand how AI reached the diagnosis. If you are able to understand a bit of it, you will be able to make a better diagnosis in terms of the false positive or false negative. And I think it's a very critical point that as clinicians, that is where we are the gatekeepers. That is where we'll be understanding, you know, whether we are dealing with something which is falsely diagnosed or which is a true diagnosis.
Modi.
Regarding therapeutics, now see, there are a couple of things here. First, we need to understand that if you go to ChatGPT and ask them, I've done that many times. I've put up the patient's geography and anatomy over there. Tell me very clearly, you need to go to a qualified medical practitioner. We are not authorized to give you a therapeutic outcome. So because of ethical and various other reasons, AI will not give you a therapeutic outcome currently. It is not licensed, it is not approved, and it cannot be approved in the near future to replace a doctor. That is the first thing. Prescriptions cannot be generated by AI. Now, where are the therapeutic roles? As of today, there are a couple of areas where it plays a very important role. Robotic surgery is done in a much better manner by an AI than by a physical hand. But of course, there is a surgeon sitting and supervising. The advantage is the surgeon can be 50 kilometers away from the OT and do the robotic surgery through AI, which was not possible when AI was not there. Second thing, you're getting a lot of wonderful new drugs. Now, there are drugs which undergo phase 1, phase 2, phase 3, phase 4 studies. A lot of money is wasted. A lot of pharma companies are wasting their money because many molecules are thrown out of the window because they have not given the desired results. This whole thing can be done as a silico analysis. It is called as a silico analysis. I can run the entire phase studies, tell you whether the drug will work or not, save millions of dollars of research and time, and can do a lot. And a lot of development has occurred because of AI. A lot of new molecules are getting channeled out in a very successful outcome. That is where AI is playing a good therapeutic role. Now, as far as therapies are concerned, there are a lot of areas where early diagnosis. Now, there are FDA approved. I gave this talk few days back in ACP. There are FDA approved ACP startups in US which are picking up blood cancers, which are picking up lung cancers and breast cancers and certain soft tissue cancers before they can reach a magnanimous magnitude, and therapies are being done. Biopsies are getting avoided in false positives. IC bleeds. I think the name is, if I remember now, it's RX or something. Large volume obstructive strokes and IC bleeds are getting picked up to the tune of sensitivity of 93% and specificity of 96%. And the time of pickup is less than 5 minutes. So that is where I say it's a therapeutic application. You're picking up a potential death, a potential stroke, treating him on the spot. Suppose that person had gone to an MRI and had come to the clinician, there would be at least a sort of a time of 1 hour to 2 hours. By the time the stroke may not be reversed if you were to give thrombolytics, or the bleed may have increased by the time you would put him on antihypertensives and other anti-edema measures. Whereas AI can shorten the time in less than 3 minutes, and results have been fabulous. These are in vogue applications in US. In COVID, Israel has used AI very nicely, where a contactless therapy between the clinician sitting in the ICU and the person sitting in the ICU, the AI sitting in the ICU giving the therapy has given much better results. And back home, a part of AI was used in Fortis Hospital in Mulund, where AI was being used, and a lot of COVID care was improved because of AI. But no, an AI cannot take the role, a larger than life role. Like celebrities have taken a larger than the life role in movies. That cannot happen in real life, no matter how well AI develops. We need to remember that AI is a marriage between an engineer and a doctor. The algorithms are written by engineers for which we have no idea. They know what algorithms to write, and we are here to supervise them and guide them. So AI cannot replace therapeutics totally. It is not possible as of today, at least, but it can be a big add-on in improving the quality of care. So what I do, for example, I upload the data to my AI. I prod him 4 to 5 times. Tell me, what prescription would you generate? It gives me ideas, where I could go wrong. But let us say there is a dengue with low platelets. The NS report is negative, antibodies are negative. You want to treat as dengue. AI will tell you can't, but then it is your call and you have to treat, or you lose a patient. I have a person whose EGFR may be 40. I think it is necessary to continue metformin. AI will tell you, boss, you cannot give metformin, but here you will continue. So there are areas where AI can nudge you, can guide you, but it cannot replace you. So therapeutics is a big role, but it is not meant to replace you, or you cannot just put AI and go for a movie and let AI take care of it. Those scenarios are not working anywhere. At the same time, these are generative AIs, these are learning AIs. The more you teach, the more they learn. So the more data you feed in, the better they become, they evolve. These are learning models, language models. They keep learning and relearning, and they can give you a lot of information. And I would like to point out a lot of ethical, moral, and legal concerns about therapeutics, which is very important. A real life example is this, that there was a case where a guy uploaded photographs of his child getting bath, or getting treated, or getting covered in his childhood in a naked position by the father, and he uploaded those photos in Google Photos and got transferred to Facebook, the AI in Facebook. And your photos are being scanned by Facebook today. It directly complained to FDA that this guy is doing child pornography. He was put behind bars. And then the issue, and this is a real story, and then the matter got sorted out that AI misunderstood his taking care of his child as child pornography. So they could be real bad setbacks. So we have a lot of applications which are really worthy, and diagnostic is, I'll say, 80 to 90%, therapeutics is 10%. But your hand is required. Your finger is required to finally take a final call, and not AI. I think I'll stop there. There are so many things which we can talk about, but it's a wonderful area. It's a fantastic new marriage. It's something like a girlfriend and a wife. Please explore. Wonderful spouse should be a companion. And believe me, working with AI has got its own humorous sides. And if you permit me, if sir permits me, I'll tell you, I asked my AI very nicely. I got married. I had a girlfriend who's not my wife. How do I improve my relations? You permit me, I'll give you a humorous answers that AI gave. I was shocked. It is better than chat. It's better than Facebook comedy, better than Kapil Sharma show, if I should take the name, better than many comedies. I got fantastic answers. AI can really help you with your practice beautifully. One thing, you do it, let not your patient do it.
So what happened with your wife? Or what she told to you?
So nothing happened. I had a love marriage. I told AI, she was my girlfriend, now she's my wife. I want my girlfriend back. He told me, this is a wrong thinking, go forward. I said, no, I want to see my girlfriend and wife at the same thing. He just told me, I think you seriously need a marriage counselor.
Okay, I think Dr. Kulkarni, there is one more question. What are the risks of AI in medical imaging? So you answer and then you can conclude.
Okay. Thank you. Thank you, Om, Alok. Dr. Singh, I really appreciate picking up the young generation.
Dr. Kulkarni, I also had a Dr. Kulkarni, I also had a question that we have so many AI algorithms, softwares. So is there any body which looks into the standardization of these softwares, and how to know which softwares or which algorithms are accurate?
The second question first. There is a huge change in the governmental setup because of the Ayushman Bharat digital health scheme also. So they are coming out with separate standards for Indian instruments, Indian policies. I think Om and Alok are knowing about it, and we are giving regular feedback to them. About the medical imaging question, I think it will be more of an advantage rather than mismanagement, because medical imaging like a third eye of the clinician, and it will detect the lesions at very, very early stage. I can give an example of dermatoscope. Dermatoscope magnifies the skin lesion 300 times. Tell me a microscope which magnifies the lesion 300 times on your TV screen of 54 inches. So you can pick up malignant melanoma as early as possible. There may be, few translational errors, which, to be very frank, we are not aware of it. Om and Alok made light on it. But till today, there has been no much talked or thought about errors of digital imaging diagnosis. If you have got some article about it, or if there's something like a misdiagnosis, but misdiagnosis cannot be crime. There may be always a correlation with the gross pathology, with the regular pathology, histochemistry, and molecular biology. So that will aid into a continuum. Anything want to add, Om?
Sir, I think it is also prudent that this is called human in loop system. So what it means is that currently whatever medical AI tools that we have, all medical AI tools, whether it is licensed or not licensed, doesn't matter. At the end of the day, it is the clinician, it is a doctor who has to make the final diagnosis. For example, let's say, a AI tool is now we're trying to develop a computer vision tool for thyroid nodules. Now, what it does is that computer vision tool, it gives the TIRAD score for the thyroid nodule. But it is for you as a clinician to correlate that with the actual image and say that whether the diagnosis which the machine has made, whether it is correct or not, right? So end of the day, same way, for example, a radiologist gives you the diagnosis, okay, fine, this patient has, this is the diagnosis, right? But as a clinician, you are then making the final diagnosis, whether I want to proceed with this further or not, right? So there are different layers to what no surgeon is directly going to operate on a lesion just because an AI told that, this is a possibility of a lung, malignancy, right? So there are many doctors involved in that. There are many layers involved in the process. And because of this many layers, there will always be cross-check and multiple checks which happen. So it is unlikely that some AI makes a diagnosis and some surgeon operates, right? It's not going to be that. There are multiple layers in between that, right? And that layers are very important for us to really proceed further. And let me add this one point. I think this is a very fundamental point that a lot of people need to understand. How a computer thinks versus how a human brain thinks, right? The computer generally thinks in a binary logic. This is something very important. So we need to actually understand both the fundamental process. We need to use a little bit of binary logic in our life also, and a little bit of the other logic which is called fuzzy logic in their life also. So what is binary logic? Binary logic is 0 and 1, right? So machine basically understands either it is 0, it is 1. Either ये cancer है कि नहीं है, right? Yes, no. It cannot have थोड़ा बहुत cancer जैसा लग रहा है. It cannot be like that, right? It is either temperature is 40 degrees. If you say that more than 40 degrees it is cold, it is warm, then it is, if the temperature is 40.5, it will say it is warm, and it is 39.5, it will say it is cold, right? So it is binary logic, right? Whereas in human terms, we use something called fuzzy logic, which is like, थोड़ा warm लग रहा है, थोड़ा cold लग रहा है, थोड़ा ठीक नहीं लग रहा है, थोड़ा chest pain लग रहा है, right? I'm feeling dizzy, I'm feeling anxious, right? We all use terminologies which are very personal to us, right? Which machine cannot understand. That is the beauty of this, and that's why human beings are ultimately important, right? Sometimes you have that sixth sense and instinct that, look, मुझे ये लग रहा है कि because this guy is a smoker and because this guy, even though that the AI is saying that probably it's a benign lesion, I have a gut instinct which says that probably there could be a malignancy, so I would consider doing a biopsy, right? So you have that gut instinct, you have that sixth sense, you have that fuzzy logic which machines do not have. Hence, it is very important that all AI generated systems are cross-checked by human beings. That is called human in loop model. So in medical care, there is never going to be a system where you have directly AI communicating the final diagnosis to the patient. It is always going to be a doctor in the middle, because AI, I'm not saying AI make mistakes. What I'm saying is that AI requires a gatekeeper to really make sense of the information given and then give the final product to the patient.
I think excellent, Dr. Kulkarni. Your last message.
No, I just want to tell Om about his ring in his finger.
It's a 200 rupees ring from Amazon, which just looks good. That's why I'm wearing it. So no reason for it. It's not a smart ring.
I have a lunar ring. I have an actual ring. Samsung is coming out. I'm not wearing it.
Yeah.
That is better than a smartwatch. I'm actually using it. I was the first person in India to buy that. It's measuring my entire sleep rhythm and everything. I'll show it some other time. And sir, with due permission, I just wanted to add a couple of things. The Burhan Heart Institute in US is actually picking up cardiac failure within 10 minutes of the patient walking into the ICU through algorithms. The Mayo Clinic is picking up acute kidney deficit the moment patient walks into the ICU before the creatinine report comes in based on multiple parameters, including his lifestyle, his health, and the sensitivity and the specificity have touched 96%. There is a huge sepsis clinic running in the US where the turnover time is 3 hours versus 3 days in a normal ICU. So these are real life practical applications of AI with data, with research being done and shown that the algorithms are more accurate than human beings picking up or the labs picking up. 2-3 real life examples. In your diabetes practice, you have got some 50 CGMs running on your computer. You don't know who will go into hypo, who will go into ketosis. AI can flag up. It can create red flags in 4 patients. So you know where to act. Otherwise, it will be manually difficult. The pathologist can pump 100 histopath reports. AI will tell you, these are the red flags. Now, like Dr. Om said, Because AI say these are cancer doesn't mean the patient starts getting treated for cancer, but it reduces our time, the turnover time, the TAT in a huge way because you're putting AI as an interface. Now, when we see those reports like home side, we get a lot of patients with reports from corporate labs with some 50 pages and 60 pages running. We can't go through every data. So we pick up arsenic is high, vitamin D is low. Some reports are highlighted. We focus over there. AI will pick up your entire practice and tell you these are the areas, problem areas where you need to give more focus. So it reduces your turnover time in a big way, but it doesn't replace you. In fact, it augments you, it helps you. So that is where, and just a very important thing, something that everybody should know. Sinomed is a language which is replacing ICT officially. The Sinomed Institute has been opened up in Pune. The government is working actively on it. Like he said, Ayushman Bharat is tied up with it. In the next coming years, the official data is going to come in, where what it means is that your entire patient database would be listed out in Sinomed with all the diagnosis and all the therapies. Whichever doctor has treated you, it will be linked to your ABHA card. Now, ABHA card is officially in place. I have created my own ABHA card. Government is going to make it mandatory for everybody very soon. ABHA is the equivalent of Aadhaar card in the health medium. So just as our entire identity is with our Aadhaar card today. So the entire health record will be linked to your ABHA card. This is officially that I'm telling you. Your entire database will be read by Sinomed, where AI will be working. And this, what it happens is, if my patient goes to home, my entire medical data will shift to OM through ABHA. And OM will know what has been done by Dr. Singh sir, by Dr. Akash Singh sir and Alok. And now that the patient has come to Ahmedabad, what I need to look further. So AI will work out everything for OM, and OM can take the call within 5 minutes. He doesn't have to go through some 20 files. So that is where things are working, and this is going to be linked up with your insurance. So this is officially in place. Government of India has approved it. It will be in action within 3 years. So this I'm telling you officially. So it's time that we realize this, because this is the truth. And there are so many other applications which I can talk about, but this is some of the things which are actually working in real life today. Dr. Om, would you like to add to it what I said about ABHA
I
and
think Dr.
No, I
Om,
think it's great.
yeah. So I think before Dr. Kulkarni concludes and Dr. Akash Singh gives the vote of thanks, Dr. Patni, in short, what do you think that our physicians should take home message today? Have the take home message. What your message for on the subject?
Yeah, on what I heard from Dr. Kulkarni, Dr. Om, and Dr. Modi, I think few take-home points are straightforward. That we need to understand AI. AI is a complementing technology, I would say, to your practice. It will augment your basically the mechanism of diagnosis and even therapeutics, but it's not going to replace you, right? So what we are a little worried about is that we are dealing with a huge population, let me tell you. AI should ideally be supportive of that. But how you are going to incorporate so many doctors from almost all parts of the country, particularly those who are practicing in rural areas, and those who probably won't be able to incorporate this AI into their clinical practice. So how we are going to interlink all of them? That's very important, because if each and every one of us do not get linked with AI and use them for a better clinical practice, then probably we won't be able to give the similar kind of structural care to all patients. This is one thing. Number two, to Dr. Kulkarni in particular. So if AI in imaging is so very important, why it is not mandatory? Because if you just read a simple X-ray and you have 3 or 4 radiologists reading an X-ray, all of them are giving different views altogether. I can give you an recent example actually. Now, if it is becoming mandatory that you should take help of AI also, and then obviously, as Dr. Om said, you have to use your own intelligence in order to understand which is correct and which is not. So don't you think it should be mandatory as far as radiology goes or imaging goes, because that can pick up the lesion quite early in the disease?
Yes, the things are going on in this direction only. And Dr. N.K Singh, if you want to conclude, is that know AI, understand AI, practice AI, and you will be master. It is a cycle of KABP, that is the knowledge, attitude, our assertiveness about it, behavior, and practices. Our practices will definitely improve. Our patients will be definitely benefited. Start using from very, very single things. The point which you raised about using AI for ultrasound and other things, that has been picked up so many years before that. It requires large amount of training for the image processing. So that the cost has been reduced, and it will help to give a better and much more accurate diagnosis. Dr. N.K Singh, I really thank you about this opportunity. और हमारा जवानी का जोश है, आलोक and ओम, और थोड़ा सा सीनियरिटी का होश है. It has been a really wonderful time.
No, sir, it is really wonderful today that I myself understood many things which I was not knowing, and you have critically analyzed the real scenario of AI in India. And I think now India is a digital country, and even at the village level, people are connected with the net. So I think there is a huge application. Even in my clinic, my echocardiography machine is using AI, my fundoscopy is using AI, and lots of things are happening. So with this great opportunity, and Dr. Alok Modi and Dr. Lakhani has given a wonderful insight. So Dr. Akash Singh, you just conclude and give a vote of thanks. Unmute yourself, unmute. Yeah. Dr. Akash, unmute. Yeah.
I sincerely thank Dr. S.V. Kulkarni, the senior most person in the AI in medicine, whom I had opportunity to hear several times. I also thank Dr. Om Lakhani and Dr. Alok Modi for their brilliant deliberations. I thank Dr. N.K Singh for conceptualizing and organizing this program, Dr. Vijay Patni for being there with us and to offer the valuable insights and the take-home message. I finally thank the USV team for taking care of the technical aspects of this meet. With this, I request Dr. N.K Singh to conclude the session.
You well concluded, Dr. Akash, by Dr. Kulkarni and Dr. Lakhani, Dr. Patni, Dr. Modi comments. And Dr. Snehal, now your turn, finally.
Yeah. Thank you so much, Dr. N.K Singh, sir, for the fantastic moderation, and not to miss the beautiful lecture by Dr. Kulkarni, sir. We have learned so much about AI today, sir. Thank you for adding this different perspective into AI, because as the healthcare professionals, this has been an on-demand topic, and that we had to address this topic with such an expert panelist like Dr. Lakhani, sir, Modi, sir, Patni, sir, and Singh, sir, as well, to add your valuable insights. It was really a wonderful lecture. And all the audiences have also appreciated tremendously for this beautiful topic selection, which is different from the routine ones. So thank you once again, Kulkarni sir, Lakhani sir, Modi sir, Singh sir, and Patni sir, and not to mention Dr. N.K Singh sir also, for giving us this fantastic opportunity. So we had more than 800 doctors live today, and much more than 1,000 plus registrations as well. So we thank all our doctors as well for your active participation. And we will see you yet again with another interesting session in the CME India series. Thank you once again, dear doctors.
Thank you, Snehal. So last
Thank you so much.
slogan is,
Yes, thank you.
अपनाएगा
Kindly
इंडिया
share the YouTube
AI, तभी
link.
तो बढ़ेगा इंडिया, है ना?
Yes, yes, sir.
Kindly share the
और
YouTube
हमारे
link
डॉक्टर्स
for
को
the
भी AI
people.
अपनाना चाहिए. Thank you very much. Good night.
Thank you. Good night.
Thank you.
Thank you,
Good
everyone.
night.
Good
Good
night.
night.
Snail, please share the YouTube link.
Yes, sir.